We provide a very wide range of activities, but I guess there's four main areas. We are particularly interested in working with organisations that are interested in reviewing their services and maybe developing new programmes of activity. We call that service review and consultancy. We enjoy putting together training programmes that are specifically designed to help people think about new skills and sharing the experience we've had developing services locally. We arrange for people to have opportunities to have research and training and clinical attachments with us that enables them to work as part of multidisciplinary teams so that they work alongside our multidisciplinary staff. And indeed we provide educational visits, which is really an example for people to spend some time with us and find out how we do mental health care in this part of the world. When we're asked to help review services, it's usually because our colleagues have in mind that they want to make some changes, or perhaps they even want to develop new services. So what we can do is to work within something we call the Maudsley International Quality Framework, and it basically provides a template to think about aspects of service provision. It enables us to work collaboratively with colleagues to think about what's working well and maybe what might work better. And we obviously reflect on the experiences we've had of the things that have worked well for us and maybe the areas for improvement. And it usually leads to the organisations having a development programme that's supported by their key stakeholders. So it's very much a joint approach, working collaboratively. Colleagues often request that we put together specific or bespoke training programmes for them, and that's based on their particular learning objectives. What we do as a response is approach a number of our key clinicians or key managers or key academics, and we put together a programme that specifically meets the needs of our colleagues. The format of it is usually interactive, but we have an opportunity to talk about our experiences and our know-how, but we also are very interested in hearing about the experience of colleagues overseas. So it's very much sharing experience and thinking about what we can learn from each other. There are many colleagues overseas that don't have the opportunity to have a wide range of experiences, whether that's in a research or in a clinical environment. What we can offer is the chance for people to spend some time in our services or in our research departments, and it enables people to have experience of working in perhaps more specialist services than they might have back in their home country. Usually the objective people have is to be able to take some learning back to their home country and hopefully be part of developments there. When we provide educational visits, it very much focuses on our colleagues having the opportunity to meet staff who provide our services on a day-to-day basis. So that means managers, it means clinicians, it means academics who are working together to provide services locally. It's very much based on the idea that we can share experiences of what works well and what works not so well, but it's very much about sharing experiences.